Well, we've noticed that, particularly during the COVID period, we had a loss in continuity and challenges with access. So our patients really wanted to get the care that they needed, but they were having difficulty accessing a regular clinician on a regular basis. If a patient would like to access care, they can do that in 3 ways. The first is the online route, and now over 75% of patients utilise this route. We've then got the access on the telephone, but that's much improved now because so many people are online. Patients can also just walk in, and that means that they can access the care that they need, but they're all risk assessed along the same triage method, which means that everybody has the right chance to get the care that they need and it's prioritised.
When we looked at different software to move to last June, we looked at how we could integrate it so that when the request comes through, it shows both a patient RAG rating and a problem RAG rating. So for the patients, red would be someone with various long-term conditions, or they might be frail or more elderly or have a cancer diagnosis. Green patient would be someone who's young, fit, healthy, doesn't have any LTCs, for example, and then amber is kind of somewhere in between. We also have a RAG rating for the problem. That'll be how urgent it is to be seen on the day for those specific symptoms that they've come through with. We use a patient health teams model. That means that our patients see their usual team rather than a usual clinician. When a patient requests an appointment, if it's for a new condition that they haven't consulted with us before, they'll fill in our online consultation form. What will happen is that will come through to our reception team. We use non-clinician triage. They will get a summary of their symptoms, and it kind of goes through the red flags, and it'll also have the RAG rating for the patient, so say if they're a red, amber or green patient. They'll use the data that they've got to triage it appropriately, and if it's something that they've consulted with us before, we can book a follow-up with the GP that they've seen. The red patients is more important for continuity, so we'll make sure that they're with their teams, whereas green patient who might come in with an acute problem is more likely to end up with our urgent care team because they can deal with the problem in isolation without it being linked to lots of the other conditions. That was really easy, so the whole process took me a maximum a couple of hours just to get that into our clinical system. It's really helpful because you can have it in a variety of ways, so you can have it as like a warning that pops up when you load a patient's record, or you can have it kind of on the side so that you can choose to look at it if it's useful. We just had to import the list to add correct codes onto the records and then import the protocol to make that pop up. Ran some training for our clinicians just so that they would know what it would look like and kind of what it meant. For our reception team, obviously, we did extra training for them, what it means, what the implications for the types of appointments that they might book or who they might see. Generally, it was a very quick process, nice and easy, and actually just gives us more information to do the work that we're already doing. Segmentation has made a huge difference to how we do our triage, as previously mentioned, and that's made a massive difference in terms of our continuity for patients. It means that we can catch diagnoses much earlier. It means we can have better continuity of care and just being able to see them holistically in terms of health and well-being.
So for patients, they've been able to benefit from improved access and improved continuity for their care, being part of a patient health team which surrounds them and helps support them. As staff, we've been able to access more learning opportunities. Clinicians have more information from the digital triage. They've also got the opportunity to develop in their roles. As a practice, we've been able to gain benefits because we can manage our flows much better. We're more efficient with how we work through, particularly our on-the-day work. But also our long-term condition work as well has now got this risk stratification, which means we prioritise the right patients. As a system, we've been able to support the system in its future planning because we're seen as an exemplar and a beacon of the way forward.
Hello, I'm Kalpana. I've been a patient at Brookside Practice for over 30 years and have seen numerous changes. The triage team ensures that the patient's needs are prioritised by administering the right care at the right time in the right place. I'm proud to be a patient at Brookside Practice because they have and continue to deliver excellent service and embrace technology to deliver best and reassuring practice to the community. So keep up the good work.
We're looking at ways that we can look at our scheduling differently to see if we can further prioritise red and amber patients who come through as a result of the segmentation work. We're also looking to support the ICB with getting this out to as many practices as possible, with an aim for all Berkshire's practices to have segmentation at least by March 2025. We're working with our local acute hospital to see if this can be developed in the acute hospital trust emergency department, but also other outpatient departments as well. We're also looking to see if this can be part of a national direction of segmentation and digital triage and help inform processing and discussions that happen at that level.